what's going on? Welcome to the Big Co Show. It's your boy Big Co. It's been a couple of weeks since we've been in the building, but we are back. I'm solo, flying solo tonight. Arvell couldn't be here. He's doing some Christmas shopping. I won't talk about last minute procrastination or anything like that. But shout out to my man Arvell, Mastermind. I miss you, brother. Can't wait to get you back in studio. We got a lot to talk about. First of all, I want to talk about my sweatshirt. Hey, can y'all see my sweatshirt? Boom. Shout out to Derek Jackson Art. I've been waiting on, to get my sweatshirt from my mans. I got a lot of talented friends that have businesses and brands, and we want to showcase and spotlight some of those brands on some future shows. So if you do have a business and you're an entrepreneur, you can email us at thebigcoastshow@gmail.com. Love to hear about your business, and we definitely want to support Black businesses, particularly in this pandemic. So that's what we're talking about today. So recently, I'm sure everybody's aware that there have been 2 vaccines that have been approved, the Pfizer vaccine as well as the Moderna vaccine. So being that it's been a very, very hot topic, with everything going on, we're over 300,000 deaths due to COVID-19. So we wanted to talk about specifically how our community looks at vaccinations in general and this particular vaccine specifically. So what we have some people that we're going to talk to tonight. So I'm going to bring on some of our guests that we're going to have joining us today. We got some people from the medical community, as well as just some concerned parents. I have a friend of mine that, is a naturalist. Welcome to the show, everyone. How's everyone doing?
Good.
Great. How you doing, Big Co?
Man, I'm good, man. Good to be amongst the living, So we're going to go around the horn. Tamika, welcome to the show.
Absolutely.
You kind of missed the pre-production, the 2-minute pre-production call. So basically, what we'll do is we can start with Tamika. If you just want to give us, the background, what you do, let us know your credentials, and then we'll go Tamika, Leah, Rush, Safwan, and then we'll get into the discussion.
Hello, can everyone hear me okay?
Yep.
Hello.
Hey.
Good evening, everyone.
How you doing?
I'm good.
I can't hear.
Yes.
You can hear? You can hear?
Good evening.
Well, I just want to introduce myself. My name is Tamika Jordan. I am a
Great.
clinical laboratory scientist. I have a bachelor's in biology, and I also have a master's in clinical laboratory science.
Go Dogs. Dr. Brown. Leah, can you hear okay?
Can you hear me?
I can hear you now.
I can't hear you.
Let's see. Can everybody else hear me?
Yes.
Yeah, I can hear you fine, Leah.
Okay, now I can hear you now. Okay, I'm sorry. I must have had I missed the beginning part, so I apologize for that.
No worries.
I can hear you well.
Okay, so we're
So, Dr. Brown, tell us a little bit about yourself.
okay. Hello, everyone. I'm glad to be here. I am an orthopedic surgeon that specializes in sports medicine and surgery of the knee, shoulder, and elbow. So I'm double fellowship trained, and I have been a board certified orthopedic surgeon for over 10 years. And I did my undergrad at Georgia, my medical school at Ohio State in the Cleveland Clinic. Then I was active duty in the Navy for quite some time, and then moved out to Arizona, and I've been practicing here for 4 years. And I take care of every level of athlete and non-athlete, from professional to the pediatric kid, and just have a passion for science and medicine and wellness.
Awesome. So, Rush.
Yes. Can you hear me?
Yeah, go ahead.
I'm a doctor of nursing. Have a DNP in nursing. I was an LPN, RN, BSN, MSN, and I got my doctorate in nursing. I'm a family nurse practitioner by certification, psychiatric mental health nurse practitioner as well, and I specialize in geriatrics.
Awesome. Welcome to the show. Safwan Muhammad, my brother.
Oh, my brother. Can y'all hear me?
Yep, you good.
I'm one of the most decorated biologists in my No, I'm just an individual. I study, of course, I study nature. Can't call me a naturalist to a degree. And I'm here to just kind of learn and listen, but also give maybe another opinion or another perspective that maybe
Awesome. So welcome everybody to the show. So I know for a fact that Tamika, Leah, and Rush have all been vaccinated. You know, I saw on your social media that you've all received the vaccine. So I just want to go around the horn and kind of talk about, you know, what are the situations going on in the hospitals from the actual like frontline people being out on, like here in Georgia, and I saw in California where they're running out of, you know, hospital beds and IC units are filling up. So what are you seeing, you know, as being frontline medical professionals? What are you seeing on the front lines, like for day to day, you know, in this COVID environment? And then what are some of the insights that you can give in regards to how you think the vaccine can affect, you know, what we're dealing with on the day to day? And we can start with Tamika.
First I'd like to say I'm also the manager for LabCorp, so I actually perform COVID testing. I perform COVID IgG testing and COVID IgM testing. And just for a difference, your IgG is an active infection. Your IgM is an active infection. Your IgG is someone who's built up antibodies to the infection. So I do test for both. So the difference I've seen as far as testing, as far as infections go, when we started out maybe doing this maybe a few months ago, the positivity rate was probably at about 10% of the specimens that we received in. Now that has jumped to about 30%. So there's been a huge increase in the amount of positives that we're getting into the lab now. So I've definitely seen that difference.
So in regards to spiking cases, do you think it's the I guess the residual effect of like the Thanksgiving holiday? Like what would you attribute, you know, some of the spike in the cases to?
Well, we definitely know that it was the Thanksgiving holiday travel and the big family gatherings, and you know, people being COVID exhausted. And I think being, you know, Thanksgiving being the time, and the holidays in general being the time where people want to get together, it's harder to have that discipline to maintain the social distancing and to do the things that just essentially are uncomfortable, especially during the holidays. This is what we're seeing. It's indisputable. I'm in the hospital, so I'm the chief of surgery, and we had to make a very hard decision last week to stop elective cases. And so a lot of what I do, not everything, is elective surgery. So if you've torn your ACL or if you need a shoulder replacement, those surgeries are being put on hold because we've got to reserve all of our resources to take care of sick patients. And our ER is full of COVID patients. Every single person, it seems like, that is coming in for COVID. And, you know, whether, you know, someone, you know, when we talk about death rate and positivity rate and all of these scientific terms, if you humanize it and say, you know, these people are coming into the emergency department with emergency issues related to COVID, and our ICU is full, so full that we're having to utilize the PACU or the post-operative care unit, or we're having to open up other floors, or we're having to shut down other services so we can utilize all of our resources to take care of very, very sick patients. And so, you know, we're talking more, you know, it's more than just beds that we have to have. It's the people to man these beds. It's your healthcare workers. It's everyone that makes this system work. It's stressed. It's just being overpowered by what COVID is doing, especially to our community. So it's real. It's a real thing. And, you know, whether someone dies or is admitted for a heart attack, a pulmonary embolism, or pneumonia, it's COVID related. And it doesn't really matter, because that is what COVID is doing to our bodies.
Right. Rush, what are you seeing on the front lines?
Well, like I said, my specialty is geriatrics, but I'm also an ortho nurse. So what she was just telling you is absolutely correctly. A lot of elective surgeries have to be put on hold. But when you work with the geriatric population, a lot of people forget that their immune systems die down quickly. They don't have the resources to fight off infections like a younger person, a more healthier person who has great air exchange. That was one of my number one reasons that I took the vaccine myself, is because I would have never become a doctor of nursing if I didn't absolutely 100% believe in healthcare. And like the doctor just said, in March, I had no COVID patients. I have well over 400 patients now, and I can tell you at least 200, 250 of those 400 patients that I have had a case of COVID. That's not by mistake. So, I mean, what the doctor is telling you, many people are not washing hands. That's first and foremost. They're not wearing a mask at all times like they should, and they're not social distancing. And I've had family members. I've had a recent family member in October who died of COVID. So I would never want to go into the hospital knowing that I had an opportunity to be vaccinated and I chose not to do it. And now I'm in the hospital fighting for my life. So in the long-term care places, which are like nursing homes and geriatric places, we're limiting visitation to certain areas, visitation only 30 minutes with certain family members coming in and out of the facility. And each and every employee of the facility is being tested weekly. So we know if someone has it or if someone has been exposed, because regardless of what goes down, the CDC and the local health departments are here in the facilities testing every employee every week.
All right. So in regards to the vaccine itself, so I've seen, a lot of reports, and I can see like a lot of the professionals that are putting out at the front of this conversation have been, men and women of color, because let's talk about the elephant in the room, right? In our community, like I would say there's an adverse, opinion of vaccines in general in this country, particularly in our communities of color. And, we could talk about the Tuskegee experiment. We could talk about things that, have happened, 30 and 40 years ago. But we can also talk about, mortality rates for, African Americans versus other groups. So as professionals, what will you say to someone who has very real, apprehensions about taking this vaccine that is, pushed out by the government and through a system that, no offense to anybody on the call, but a system that really has, kind of underserved the Black community? So what would you say, to someone, because you've all obviously taken the vaccine, so you absolutely must think that it's safe to take. So what would you say to someone who has those reservations?
I think it's really important, first of all,
despair within our community, because I think us as a community, we need to become more involved in a lot of research and clinical trial studies, so we are more represented with these, and that I think that will decrease the apprehension to getting vaccines or getting different types of treatment. I know a lot of people bring up the Tuskegee experiment, but in that instance, I think that's kind of comparing apples and oranges, because in that particular case, these men were denied treatment, where this is, actually giving treatment or trying to prevent a treatment. So I usually don't think that's a good comparison, but I do understand a lot of people are anxious about taking it due to healthcare disparities within our community. But I think if we get more involved in the research studies, in the clinical trials, and I think that maybe that would alleviate some of that.
Dr. Brown, you want to say something?
I think it's important to recognize and not minimize the trauma that Black people have suffered from our nation as a whole, medically, politically, psychologically, financially, socially, in every way. We have been traumatized, and it doesn't need to be the elephant in the room. We need to talk about it. It's something in medicine that I'm personally ashamed of. I think that the more we bring it up, the more we're able to deal with it and hold accountable a system that has not been fair to us. I think when we're talking about our own care, though, it is our responsibility to make sure that we're advocating for the things that we need and the things that will help us. I think that by recognizing the disparity that we've had in healthcare in general, but not shooting ourselves in the foot and denying access to things that can actually help us, it's a double-edged sword. So I try very hard not to shame people for having certain opinions, whether I agree with them or not, because it is hard to cope with that kind of trauma. That said, when you're looking at what actions are occurring, if you have a therapy that they are pushing on specific members of society. So essentially all of our frontline workers are getting it. So if there's something that's really, quote, shady being done, they're going to annihilate the entire healthcare system. So all of your high level political people, all of your rich and famous folks that are jumping to the front of the line, all of those folks are the ones getting vaccinated. So if you're trying to mitigate your risk, use all of the information available to you. The science is complicated. I don't want to be, I don't want to make it seem, I don't want to simplify the fact that it's a complicated science to try to explain how the vaccine works. But if the vaccine were truly being experimental on a certain segment of society, look at the segment of society that is getting the vaccine. So that's something to assess. And I also think it's important to mitigate your risk of what's really affecting people. COVID is killing us. COVID is killing us at exponential numbers. We are the frontline workers. We are all of these high-risk individuals, but we're afraid of the treatment because we're afraid of the system. And our fear is actually going to have a negative impact on our overall.
Right. Yeah, I know. I think I don't know exactly where that's coming from. I hope it's not on my end, but it could either. And I want to bring Safwan in because we were having an interesting conversation, about people's concerns about the fact that, we just got COVID on the scene back in March, and now we have this vaccine. There are other viruses that are out there that have been, rampant for years, and we don't have a vaccine within 6 months. But before we get into that, one of Carrie Sidbury, Go Dogs, she wanted one of the professionals to kind of explain how the vaccine works, if we can, because I think one of the misconceptions is that the Moderna as well as the Pfizer vaccine actually contain properties that will give you COVID. But I've been doing some research that kind of debunks that. So if any of the professors want to kind of walk us laymen through, how the vaccine works in regards to COVID.
All right, I can do it. I don't want to dominate the conversation, but so this vaccine is kind of new as far as vaccines are. Old versions or historically vaccines have taken attenuated or weakened viruses or weakened components to viruses and inject them. They're not really able to elicit the same response as the full-blown virus, and your body processes an immune response to it. The difference in this vaccine is that it's not a weakened virus or a dead virus. It's only a part of the virus. And everyone keeps talking about mRNA. So it's messenger RNA. So it's a very small part of the genetic code. So by injecting this into the arm and exposing the body to a small part of the genetic code, which for this particular virus is a spike protein, is just a part of the protein that's part of the coronavirus. The body then takes that small part of the genetic code to essentially the immune system to recognize and process antibodies. And that's how you develop your immune response. So you can't get sick from a very small fragment of the genetic code. So there's always this, well, I seem to get symptoms after I get a vaccine. Well, those symptoms aren't necessarily because you're getting sick from the virus or whatever it is that they're vaccinating from. It's the body's immune response to the sickness. It's the same reason why people don't recommend antibiotics for viruses. You're treating the symptoms, you're treating the body's immune response to this. So the immune response is fevers, it's muscle aches, it can be, you know, your heart beating a little bit fast. It can just be a general feeling of fatigue. That's the body's immune response to the virus, and not the virus actually making you sick. It seems like kind of just I'm being wordy about it, but it's very specific. It's important to recognize that you're not being injected with coronavirus. You're being injected with a small fragment of the genetic code of this particular coronavirus. We've been exposed to many coronaviruses throughout our lives. This virus just happens to have a particular genetic code that has just been devastating and fatal. I hope that helps a little bit.
No, absolutely, absolutely. So, Safwan, I want to bring you in, you know, at this point of the conversation, because you and I kind of, you know, had a discussion on social media, basically with the skepticism about using taking this particular vaccine. And I'll be honest with you, like, I think after the first couple of weeks, my opinion has definitely changed, you know, and having more conversation with my friends that are in the medical field. But go ahead and express some of the things that we discussed. So you had some reservations about the vaccine initially.
Yeah. Well, I'll just go flat out that I give questions to respond to. One question would be long-term effects. Taking the vaccine already. Have you considered long-term effects? Number two, being though you work in the medical field, and one of the things Corey was saying when I was talking to, I think, the physician that was on the post, one of my concerns was the mandate. Not necessarily why you want to take a vaccine based on whatever knowledge you may have. My concern was if you work in the medical field and you decide, okay, I don't want to do this, I may want to do more research, it just being a mandate. So I thought with two questions as far as this to get a better understanding of it. If you guys already taken it, I'm just wondering from that angle, was it a mandate on you, or was it something that you did from your own free will choice without any kind of respect?
So the question was, yeah, so basically the question was like, for those of you that have already taken the vaccine, you know, was it a personal choice to take the vaccine, or was it something that was mandatory? And then have you thought about any long-term effects, you know, that the vaccine could have?
Because I believe so much in our medical community, the amount of years I put into my education, I've seen the scientific work. I've seen I had a heart attack myself. I had open heart surgery, and I survived that. My concern is, even though there may be reservations about long-term effects, you can take an example from my uncle, who went into the hospital, who was walking around functioning perfectly in September, went into the hospital in October, never walked out of the hospital before October 5th, and he wound up expiring. There are many people right now who won't get an opportunity to have a choice if they contract COVID without having the vaccine. I know, as a person of color, many of my patients, many of my coworkers, many of them always ask questions about, how do you know it's safe? How do you know this? But my question to my question to them is, how will you know you're safe if you don't get vaccinated? So in my 27 years of working in the medical field, I've never had medication or had any medical professional do anything malice to me at all. And that's one of the things that I would like for the Black community to understand, that. And if you're going to see something after 20 to 25 to 30 years, you're going to see it. I've never seen medical practitioners and pharmaceutical companies particularly come out and do something maliciously with an intent to harm a certain ethnicity. It just has never happened on my watch. I would much rather be prepared for something like this than to be unprepared when I could have been prepared and not be vaccinated, and it leads to my fatality.
Right. No, that's a great point. And, you know, Dr. Rush, you and I were talking about this the other day. And basically, like in our community, we have this fear of the doctor in general. You know what I mean? So I guess my question and I pose this question to Tamika, like, how do you have conversations with your 60-something-year-old grandmother in Alabama who doesn't trust medical professionals and don't trust the healthcare system, but you know how important this vaccine is, you know, to the maintenance or the maintaining of our everyday society? So, like, how do you get around that with the particularly for people that are older, you know, older generations that, you know, live this Tuskegee firsthand? Like, what are those conversations that you're having with some of your older relatives or your older patients?
Oh, it's a struggle with even from my mother, even my husband to get the flu shot. So I definitely understand. You know, it's definitely a personal choice becoming vaccinated, and you know, speaking with my mother, you know, or grandparents or anyone that's older who doesn't trust the system, you have to say, hey, what are my odds with this? Are my odds? And my mom's like, oh, we're going to get back to normal. And I'm like, COVID is going to be part of being normal it's going to be part of our lives for probably forever. And
I think we lost Tamika. Oh, I'm sorry. I didn't do that. I promise. I think we lost her. Leah, can you piggyback off that? Like, what are the conversations are you having? Like, you old Atlanta, so like, what is the conversation you having with your people that don't trust the system?
It's hard. It's a very hard conversation because, I mean, I know that distrust is real, and it's really about just trying to talk about risk and numbers. And it is, you know, recognizing their fear comes from a valid place. It's valid. I don't want to minimize people's distrust or their hesitation. And I want to try to encourage them to be honest with themselves and to be accepting of new information. I think that that's part of the process, is being accepting of new information. We still have a long way to go in health advocacy for Black people in this country. We still are undertreated, we're underrepresented. We statistically know that being treated by Black doctors yields better results in the Black community. That does not mean you're going to have a negative result if you don't have a Black doctor, but recognizing and putting, you know, and saying, yes, I hear you, but there is new information, there is new science. Don't be left behind. Some of it is also, and this is the hard part of it, is being honest with ourselves as a community. So as hesitant as we are to accept and to recognize that healthcare is here to help us, we have some real internal reckoning to do with our own health, our own maintenance of our own health, and taking responsibility for some of our own poor health choices, at least the ones that we have control over. Being honest about, you know, are we being compliant with taking our medicines? Are we doing the weight loss? Are we eating well? You know, every side effect that you have is not because your medication is doing it to you. You know, are people exercising? Are they doing those parts to be healthy so they can live their best life? It's not just about the medical community failing them. That's how I'm processing those conversations. And it's, you know, trying to validate their fear by but also recognizing there's new information and new things to be had, and other people are being an example and showing, hey, I'm going to talk the talk, I'm walking the walk too. I volunteered. Absolutely. This was not mandated. I could not wait to get my shot. I was, as soon as they opened up our ability to do it, I signed up and got the first available appointment.
And I think we have to lead by example, being
Mhm.
the younger generation. I think we need to show that, hey, we're out there, we're going to get this vaccine, we're fine, everything's going to be okay. And I think that will help maybe motivate some of the older generation in trusting the science behind it.
Because a lot of people are saying, I'll take the vaccine, I just don't want to take it first. So all three of you have taken it first. Just talk about the experience of, actually taking the vaccine, if there were any like side effects, how long it's been since you've taken the vaccine.
Well, actually, I haven't taken it as of yet. I plan on taking it very soon. When people say, oh, I don't want to be first, I have to remind them, you aren't first. There were several thousands in trials that actually took it first. So there were about 40,000 people that came before you to take it. So I try to say that to kind of alleviate some of the nerves of taking it, that you're not, actually the first person taking the vaccine.
Gotcha. Leah?
It felt like my flu shot. I get the flu shot. I used to believe that the flu shot made me sick because I had symptoms, but as you work with the science, it's fine. I had no symptoms other than my arm is now just not sore. I got my shot on Monday, but I had no other symptoms, no chills, no fevers, no muscle aches. It was easy. They made it, it was a drive-through for us. So I actually got the shot while I was in my car. So it was even maintaining social distancing. So it was easy.
And so even with some of the side effects that people are reporting, like Leah, you kind of touched on it. Those aren't really any different side effects than would come with a regular flu shot. Like I haven't seen anything that's been like crazy to where I don't know, somebody can't speak. There was that one video that was circulating where the woman fainted, but if you read and you keep doing research, that was she would have done that if she would have had blood taken. Like she just had reaction to pain. So and Stephon posted that video, and I saw it and I was like, oh, she fainted after taking a shot. So I'm just saying, like, I haven't seen any like adverse side effects to where I would say tell my grandmother. And one of the things, like to Dr. Rush's point, geriatrics is something that's very near and dear to me. My grandmother's in a nursing home. I haven't seen her in over a year, almost a year since this thing started. There are different states that are mandating who should receive the vaccine first. Because I think, the federal government has, purchased these vaccines, but they're leaving it up to the states to say, who should get it first. In most states, they're going frontline workers, then, people that are elderly. But then you have some states that are, looking to vaccinate, the police first. Like, what are your opinions on that? Like, in terms of course, the frontline workers, I think there's no question they should be the first ones to receive the vaccine. But how important is it for states to be cognizant of the hierarchy of how the vaccine is administered?
I honestly believe that I know in Alabama, of course, the frontline workers were first, and then they're moving to some essential workers, and those over, I believe, 75 years old is next in nursing homes. I kind of look at it where I think a lot of the people in the nursing homes, or the older population, they are staying put. They're hunkering down. They're not going anywhere. They're social distancing. And I think it needs to be distributed to some of the younger demographics who are causing the spread, who's going to go visit grandma and grandpa and giving it to them. That's just my personal opinion. I think it should be distributed to some of the younger generation as well now, because that's who is fueling the spread, in my opinion.
Dr. Rush? I can't hear you.
Can you hear me now?
Okay, there you go. Here we go.
Okay. Well, I'm in the capital of geriatrics because I'm here in Florida. And one of my greatest concerns for the elderly and for the geriatric population is that their defense system just isn't as strong as it once was. I wouldn't readily recommend that the younger generations get vaccinated before the elderly get vaccinated, because the younger generation can actually make a cognitive decision to not visit grandma or to not visit the nursing homes if they know that they have not been using protocol. On the other hand, the geriatric patient with the weakened immune system could see one of the young people, contract COVID from the young person. A healthcare worker takes it to another room, and in a matter of seconds, you've got an outspread in a facility filled with elderly patients that can't defend themselves. So that's one of the reasons why the nursing homes and the geriatric population most definitely needed to be vaccinated first, because they just don't have the natural reserves that a young person would have to fight the virus off if they contracted it. I'm not saying that the young people shouldn't be vaccinated. I'm saying if I was triaging, I would most definitely vaccinate the elderly population before I would vaccinate a young healthy person, because the young healthy person has reserves and they have the ability to wash their hands and to fight off the virus more easier than an elderly person with a weakened immune system.
Right. All great points. So in regards to, I guess for me, I was with Stephon initially. Like, I was anti-vaccine. I be reading that Bible, and I be thinking about the mark of the beast and all this stuff. I was like, nope, I'm not taking the vaccine. But I honestly think, like, at this point, I'm in favor of it. So I guess my question would be to Stephon, like, have you heard anything in this conversation this evening that kind of makes you think differently, or are you still kind of proceed with caution?
If I may be honest, Corey, I think you kind of lean to one direction versus being a bit objective to the host. So if you already leaning to a side, people are not getting a balanced perspective of the issue. So I can appreciate professionals. I did learn a few things from what they said because they have personal experience. However, there's only one side being discussed. We're not having really a dialogue to really balance out different perspectives, in my opinion. So, like you're already painting the narrative about me. You said I'm anti-vaccine. I never said that.
I don't know if I said you was anti-vaccine. I said you were anti this vaccine. That's how we got to.
I've never said that.
I'm actually very curious to have a dialogue, because I'll tell you that my opinion about it has changed. So when they were first talking about this vaccine, and I'm in the military, and I've been vaccinated. I've had more vaccines, I think, than everybody here put together. I mean, I've been vaccinated in things that I didn't even know existed. So, but when I saw this vaccine coming out and how it was rushed, and it was fast, and it made me a little worried, and I was skeptical, and I felt the same way. I was like, I think I'm not going to be first. I don't want to be last, but I certainly don't want to be first. So I can appreciate that. And it took really looking at the science of it. And I'm a scientist, so, I evaluated the science in the way that I know to evaluate literature and outcome studies. But I also just kind of had to make a personal decision and a personal risk assessment, and to figure out what my holdup was. And, to talk about the rush, the quote rush on it, I think that that's a very valid discussion. And, why were we able to get this emergency use authorization? I think it's important to try to understand how our government and how things work. There is a lot of bureaucracy. Some of it good, some of it not so good. There's a lot of red tape, and some of that red tape is actually used to our disadvantage, especially as minority patients. Sometimes it's to our advantage for sure, because of situations like Tuskegee, and enslaved women being, experimented on with gynecologic surgeries without anesthesia. I mean, the list of the atrocities go on and on. So I totally want to have a dialogue because I understand where you're coming from, and in fact shared a lot of those same opinions as they were first talking about this vaccine.
Yeah, because Savon, I don't want you to think you're getting ganged up on, brother. But I mean, you were anti-vaccine. Now let's not mince words. Like, you were having full-blown arguments with people about why you didn't think it was. So let's not do that. Like, you were not in favor of this vaccine.
All you gotta do. That's why I love social media, because you can always go back, screenshot, show me my words. My words. I've never said anti-vaccine. What I said was my main argument and my main concern, and the question that I posed was not answered, and that was about being mandated to do something.
I answered. I said I was not mandated.
Being mandated to do it at a job. That was my argument with the physician.
So just to
go back and read.
I don't agree with mandating it per se. Like, I think it should be a personal decision, but with that personal decision comes certain consequences with it as well. Just like kids have certain vaccinations before they go into the public school system.
Exactly.
So,
well, may I respond to that? Because I didn't take vaccination because I use my religious background, so I never had to take that. And my parents, and we use that specifically because again, I was in public school, and I was what they call it,
exempt. You had a religious exemption.
Yeah, right. I was exempt from it. So it's all about having your own knowledge and how you were raised and things that you learn. So everybody, so when I threw that out there, it wasn't to say, oh, I got you. It's just more to say everything ain't, some people have different learning and different knowledge that they acquire from different situations. So.
All right. And it's, like I say, it's very personal. It depends. I mean, it's not a one size fits all situation at all, and it's something you have to, like I say, I don't think it should be necessarily mandated at anyone's, at certain levels. I don't think.
So, Corey, we can get into why I may disagree with, but I've never told you that. So you have not.
What happened was, someone that has a private practice, they stated that they would make it mandatory for their employees to have the shot. And that was
Correct.
the conversation that Stephon got into. So if I inferred that you was anti-vaccine from that conversation, my bad, dog. But that's what I did. Yeah.
I'd rather tell you why I may not want to do something versus it being off of that premise. And that's two different things. You know what I mean?
Yeah, because I mean, I'll be honest with you, like the rate that they brought this vaccine to market, like, that really was concerning for me. You know what I mean? And that was one of the reasons that I was kind of skeptical about. But then I understand that, we got 300,000 plus deaths, so that motivates people to do things a lot faster in a lot of regards.
And you have to remember as well, they've been working on these mRNA vaccines since early 2000. So, when SARS first came in MERS in China, so these had already been in the works. So I know a lot of people feel like, oh, it was so fast, it was too rushed, when really it's been in the works for many, many, many years.
And that's a great point that I don't think a lot of people know. I wasn't aware of that, Dr. Rich, you were about to speak on something?
Yes. Take me, for example, someone who's starting their own practice. I can, from a legal standpoint, I can actually understand why someone who owns their own practice would make sure that their staff were mandated to be vaccinated. Because just imagine the problem if one of your staff members were not vaccinated and patients were coming into your facility and they were contracting COVID from that employee who wasn't vaccinated. It would be all kinds of legal ramifications that go along with it. So as a provider, I've got to step up to the forefront and not just encourage my patients and my population to seek out the vaccine if I'm not going to get vaccinated myself. So as a person that's running the business and my job is to promote health on every front, everyone who worked for me would either have to have the vaccine
or they would have to walk away from the job until there was another way that they could safely administer care to the general public, because I wouldn't want to be liable as a provider giving COVID to innocent people coming in seeking treatment at my facility.
No, that's a great point. That's a great point. And
I
Rush,
think
no, I'm sorry. Go ahead, Doc.
Oh, so I was going to say, I think it's important to also recognize that, when we talk about mandating, you don't have to mandate something, but again, I have my own practice as well. Every choice has its repercussions, whether they seem positive or negative. And if somebody feels that, a rule that's being put in place for their job does not align with their personal beliefs, and the job's probably not a good fit anyway.
Exactly.
So, there are ways to consider that. It's not necessarily a judgment. It's not an indictment. It's, everybody has to mitigate risk. All of what we're talking about is risk mitigation.
Right.
And if, I have an employee that feels their risk of the vaccine is too great, then that comes unfortunately with the repercussion of not being able to be employed with that organization.
Right. That's a great point.
Can I respond to that, Corey?
Yes.
Sure.
Okay. Is that irregardless to the fact if they practice COVID or not? They still should get the vaccine, even if they have no symptoms, they have negative, everything is good, they're healthy. They should still be mandated to work in your facilities. They should be mandated the vaccine in order to keep their jobs.
So the problem with COVID and what makes it so infectious and so deadly and dangerous is that there's asymptomatic carriers. There are probably tons of asymptomatic, we're carrying bacteria and viruses around all the time. They're just not as deadly as this coronavirus, as COVID-19. So even though someone may be testing negative, because, actually mandating testing is harder than mandating a vaccine, it's about the fact that they can still spread it and harm other people. So vaccination, just like Mr. Landfair saying, vaccinations are protective of our society and not just the individual or just not, the one person. Again, we're mitigating risks. So just because somebody is not symptomatic does not mean that they are incapable of spreading the disease.
Yeah, and I think that's a great point. Shout out to Zwan Landfair for checking in, brother. I think that's a great point. I think that's the thing that even with mask wearing, I think it's selfish of us as a group of people to see the number of people that are being affected by this virus and not doing what the minimal things that are important to kind of keep it from getting, I guess it's too late to keep it from getting out of hand because it's out of hand. But we're coming up on time. I definitely would love to have you all back on again to further this conversation. Would definitely love to check in with you, Dr. Brown, as well as Dr. Rush when you get the second vaccination. Would love to check in with Tamika when she gets the first vaccination, because I feel like, again, and to Safwan's point, when this all first started, I was, hell no, we won't go. I promise. I was like, ain't no way in the world I'm getting this. They gonna insert a chip in my veins. Like, that was my assessment of the situation early on. But now, doing more research, having more conversations with people that are actually on the front lines, my opinion has changed. And I think it's very important that people, do their own research and not just allow social media or something your grandma told you to keep you from doing something that could not only affect you but affect people that are very close to you. So one of the things we normally do on the show, we go around the horn and do parting shots. For our parting shots this evening, again, thank you for everybody who took the time out of your very busy days to join us today. Parting shots, I want you to tell me what you would tell your 60-something-year-old grandmother about the importance of this vaccination. And we typically go ladies first, so we'll start with you, Tamika.
I would tell her, let's go together, get vaccinated together, because I want you to be around for a very long time, to see your grandkids, your great grandkids, and to trust the science. We live in a different time now, and I understand the anxiousness behind it, but just to be an example and show them that it's okay, everything will be fine, and the science backs it up.
Awesome. Dr. Brown.
So my grandmother is 93, and I have convinced her, and she was very skeptical because white oak tree bark fixes everything. And that's where I come from. But I told her I want her to be around for her 94th birthday.
Mm-hmm.
Amen.
And my fear of COVID taking her from me versus this vaccine taking her from me, and this is real talk, is exponentially different.
Right.
And I will be her health advocate. Find a health advocate, find someone you trust. If you don't know how to read the literature, find someone that can read the science. Have discussions with scientists, have discussions with Black scientists, have discussions with suspect Black scientists, because, like I said, I felt the same way. But at the same time, I've seen COVID devastate our community, and I'm just tired of seeing us dying and sick and morbidly affected from this horrible disease that is just affecting us because of who we are and what we are as members of this society.
Amen. Mr. Muhammad.
Well, I would tell my grandmother to exercise, eat her fruits and vegetables, stay away from GMO products.
Amen.
Okay.
That's it?
Oh, I thought I didn't know.
I was just agreeing with you on the GMO. No, I was agreeing with you on the GMO for sure.
Right. I would tell her to focus on things that she can do before she run to try to get a vaccine, honestly. So that's what I meant by that. So.
Got it. Dr. Rush. We can't hear you.
Okay, hold on. Can you hear me now? Yeah, I would tell my grandmother, I would never allow you to have something that I wouldn't think was safe. We enjoy you being here with the family. And if this vaccine is going to keep you here longer, I encourage you to get this vaccine so that it prevents you from being sick in the future, as well as making her aware that her health is my greatest concern. Even for the entire community of people of color, brown, Black, of all healthcare communities. If the vaccine is going to make us as a whole healthier, I feel we should all be vaccinated so that it prevents and lowers the death rate.
Great show. Again, thank you everybody for joining. I would love to welcome you all to come back on again in a couple of weeks to kind of see how this thing is going. I appreciate the time. I hope everybody has a great Christmas. I didn't get to mention this earlier, but man, rest in peace, Ecstasy from Houdini. I know I don't want to end the show on something all morbid, but that was my guy. You know what I'm saying? Houdini was my group. So love your loved ones, man, because tomorrow's not promised. Check us out on the next show. Thanks again to all my guests. We love y'all, and we out till next time.
Thank you.
Leah.
Yes.
That was awesome.
Thank you.